Another way to demonstrate how poorly TMD is understood by the dental profession is the fact, this is fact now, that 50% of dentists run for the hills or run away when they hear the word TMJ. Remember, TMJ versus TMD. The dentists still call it TMJ. The patients call it TMJ. The physicians call it TMJ. You know, I just have knees when you go to the orthopedic surgeons. All right. So 50% of the dentists, and they admit that they make a night guard for the treatment of TMJ that doesn't do anything for TMJ. It protects the teeth, but doesn't do anything for TMJ. And 50% of the dentists run for the hills and don't know anything about it. And that is the state of art. The state of the art in dentistry in 2025, and today's date is November the 4th, 2025. That's still going on. And then another way to determine how terrible this problem is understood by my dental colleagues. Remember, the physician colleagues don't want to know anything about it. They're too busy doing what they do. And my dental colleagues, 50% make a night guard and hope the patient doesn't come back, and 50% don't want anything to do with it because they know it's a lost cause, truly. And then there's the 0.009% of dentists that call themselves TMJ specialists that are nothing more than TMJ gurus using smoke and mirrors and voodoo of various kinds. Just today, I see people, so far this morning, I saw 4 consults. 2 of those consults gave me similar stories, which we hear about all the time, about going to a, quote, TMJ specialist who hooks them up to machines, who does 2-hour, 3-hour workups. I have copies of those workups. They're printed out, half-inch of paper. Just, constant nonsense, and then try to get the medical insurance companies to pay for their nonsense. I call them TMJ gurus. I call them TMJ voodoo doctors. I'm sure they don't call themselves that. They call themselves TMJ specialists. That is a fact.